Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor and the head of the Medical Information Center. Today, I would like to talk about hair loss after COVID. This is a hot topic, and I have a friend who works in a wig store and says that now there are a lot of people after COVID. By spring, unfortunately, many people are buying wigs because the problems are really huge. So let's figure it out today. I will give specific recommendations and I hope everything will be fine. At the Medical Information Center, as you know, we conduct tests using an original method. We conduct tests for nutrient deficiencies. And what did we find out? That's very important. And what did we find out? That COVID leads to a serious deficiency of nicotinic acid or pellagra. But in order to, you might be familiar with a mineral called zinc. And this mineral zinc, even in its instructions, it says that it is recommended for hair loss. So what we found out is that in order for the mineral zinc to be absorbed by the body, there must be a sufficient amount of nicotinic acid in the body. And here we come to a clear logical situation. If COVID causes a deficiency of nicotinic acid, properly called pellagra, then of course the body stops. This mineral stops being absorbed, and here we see a completely logical picture. No one ever mentions this because these interconnections are quite difficult to notice just like that. But it is precisely our method, monitoring and regular repeated tests on the same person, that allows us to identify and correct these dependencies. And we can state our conclusions with absolute certainty. So the mineral zinc, which doctors prescribe for hair loss or alopecia, however you choose to stress the word, is indeed the correct prescription. But it is very important to take nicotinic acid along with it. If we look at the instructions for a zinc preparation, then, for example, there is a medication that contains 45 milligrams of zinc per tablet, Zinctaral, I believe it's called, 45 milligrams of zinc. And if we look at the recommendations in the instructions, then for so-called malignant alopecia, when not only the hair but also the eyebrows and eyelashes fall out, it is recommended to take 2 tablets 3 times a day. That means it's almost 300 milligrams in total. That's a high dose. I would recommend taking 1 tablet 3 times a day. So that comes out to about 150 milligrams per day, approximately 150 milligrams daily. That's half the maximum dose recommended in the instructions. And it's essential to take nicotinic acid as well. 50 to 100 milligrams per day. Here, it depends on the situation. A small remark. This is not directly related to hair loss, but rather to the intake and absorption of zinc. Currently, pregnant women are being recommended high doses of folic acid. At this point, we practically have only 2 substances left for pregnant women, vitamin D and folic acid. So I want you to know that folic acid inhibits the absorption of zinc. Therefore, the doctor who prescribes it or the woman herself who is taking folic acid must be sure to compensate for possible zinc losses from taking folic acid by using zinc supplements according to the instructions. I want to emphasize once again that when you take single ingredient supplements, you should always take them intermittently. That is, you take them for 2 weeks or 2.5 to 3 weeks. Then take a break for 1 to 2 weeks. This allows the body to balance out any possible losses. Because absolutely all vitamins and minerals, trace elements, are in one way or another antagonists to each other. And only with a properly selected regimen, only with the right selection, with the right ratio, when we know what can be increased, how to compensate for it, and what should not be done so as not to disrupt the regimen. In other words, this is quite a serious professional task, dealing with these regimens. But when you take these on your own, you need to clearly understand that the intake should be intermittent. And you should have some kind of break, a few weeks, 1 to 2 weeks off from the supplement. If again you have followed all these recommendations, and if during these 3 weeks of taking nicotinic acid and zinc you don't even notice the slightest hint of recovery, if you don't feel that the situation has started to improve, then the situation is more serious. It's a more serious matter. Why? Because COVID, like any illness, any serious illness, is a huge stress for the body. And every person who gets sick comes into the illness with their own history, with the state of their body as it is at that moment. And if again such a simple regimen doesn't work, then the situation is more serious. And here you need to take our test for eliminating deficiencies so that we can look into your specific case. This is called working with a case. A case means a situation. We need to manage your situation, we will manage your case, and observe how everything changes. Because here the problem might be that the endocrine system has been severely affected, for example, the thyroid gland. Here there may be overlapping effects from medications you have taken, both those for COVID itself and possibly treatments you are taking on an ongoing basis. Some chronic illnesses that you may have. In general, this needs to be addressed very, very seriously. So to summarize, when dealing with hair loss after COVID, first, we need to know that COVID causes a deficiency of nicotinic acid. We take nicotinic acid at 50 to 100 milligrams. Second, we know that nicotinic acid helps with the absorption of zinc. Therefore, we add zinc at a dose of about 150 milligrams per day, which is half the maximum recommended dose. Let me say right away, I highly recommend splitting the first one up. That is, not taking 150 milligrams all at once, but one tablet at a time. So 3 times a day. And the most important thing in the instructions for zinc, for this medication it says that zinc should be taken before meals. But that's actually not true. First, all substances of this kind are absolutely components of food, not medicines. Therefore, they should be taken specifically with food, with a meal. Secondly, you should know that zinc can have a side effect of nausea. Why? Because it has that property. This tablet, when you swallow it, is small and can sometimes stick to the esophagus, and as it dissolves, it can cause nausea and the urge to vomit. And when you take it with food, naturally it passes into your stomach along with the food, mixes with the food mass, and this effect does not occur. But nevertheless, at first, you may experience an unpleasant feeling of nausea after taking zinc. There's nothing to worry about. It's just a minor side effect of the medication which you simply need to ignore and continue taking it. So I will continue. Let me repeat once again, okay? Once again, let me repeat. We take nicotinic acid, we take a zinc supplement at 150 milligrams per day, 1 tablet 3 times a day. We split them up and take them with food. And we continue this for 3 weeks. If after these 3 weeks you don't see even the slightest improvement, if the situation hasn't started to get better, then you should come to our medical information center. That means the situation is more serious and we need to address it in a special way. As I mentioned about folic acid for pregnant women, you should know that it interferes with zinc absorption. Zinc is very important for fetal development, so keep this in mind. If you are taking folic acid supplements, you must make sure to compensate for the zinc loss that it causes. Thank you very much for your attention. I want to remind you that our channel offers sponsorships. And now, for our sponsors. After this video, I will record a video about vitamin A. And about such an issue as which form of vitamin A to take. If people have problems with their pancreas, they cannot take vitamin A in its fat-soluble form. This is the information. So become sponsors. And next, starting today and in every video from today onward, I will be making an announcement that and when our channel reaches 500,000 subscribers, that is 500,000 people, as a celebration, we will give away 3 sets of books on vitamins by Professors Lepsky. So my friends, please share our videos, encourage your acquaintances and friends to subscribe to our channel, and make sure you are subscribed yourself. And when we reach 500,000 subscribers together, we will hold a giveaway for 3 sets, specifically among subscribers. Yes, only among subscribers. There are special programs for this, and we check whether a person is subscribed to the channel or not. I think that's great. We are quite capable of reaching 500,000 people on the channel, and I think it will be an excellent confirmation and a celebration. We will celebrate the 500,000th subscriber on the channel with a giveaway of 3 sets of books by Professor Zlepsky. Thank you very much for your attention. Become a sponsor, subscribe. Now there will be a video for sponsors.